Hello again, we are here for another monthly video, and we are in orthopedics and sports medicine today, and I'm joined by Tiffany Curnutte, nurse practitioner for Dr. Michael Chambers. She works in the office with him, and she is also in the OR with him, and is very well versed in athletes that we see here locally. But today we are talking about female athletes. Both of us are former athletes, and I know we have a variety of former athletes that work in our office that are female as well. So female sports have grown over the years, and we have seen that unfortunately they experience injuries that males don't at times. Yes. So we're going to talk about ACL injuries today with females, and so why do we see more ACL injuries in females?
So the National Institute of Health actually reported that female athletes tend to have 2 to 8 times greater chance of having an ACL injury. There are several reasons for this. The first one is that the ACL house of the knee is actually smaller in women, and the ACL itself is smaller, so we tend to have more injuries. Also, female joints tend to have a little bit more laxity or loosey-goosiness in their knee, so it sets you up for more problems. Another reason is because whenever females land and jump, we tend to land flat-footed instead of on the balls of our feet like we're supposed to. Also, we land knock-kneed, so where our knees point in. So this puts greater stress on the knee and then in turn on the ACL. Another reason that females tend to have problems is because of what's called the quadricep hamstring ratio. What this is in females, our quadriceps are actually stronger. In males, it seems like they're more equal. So this sets up our knee to have a little bit difference in strength and can cause more strain on the ACL. Thus, we have more ACL tears.
Okay. I know that's increased definitely over the years. Mm-hmm. So do you see it more in certain sports? With females particularly? There
are certain sports. So it seems like soccer, cheerleading, and basketball seem to have more injuries for the ACL. The reason for this is because of the pivoting, the stopping suddenly, poor landing mechanics, and collisions. They can all increase your risk for ACL injury.
Okay, so I know females play all of those sports and a variety of other sports. So what can they do away from the office to prevent these injuries?
So there are a lot of things that females can do to help prevent injuries with ACLs. This is avoiding overuse, so making sure that, if you play softball, that you're not doing softball year-round, that you're giving yourself time to do endurance training and strength training, making sure that you have time off, adequate nutrition and hydration, and proper rest. Rest is very important to make sure that you're not overusing these same muscles. Another thing that's important is making sure that you have proper landing mechanics. So that's where we talked about having, landing on the balls of your feet and making sure that you're not knock-kneed, that you're landing with your knees pointing straight ahead. Major thing that helps prevent ACL injuries is making sure that you have core, hip, and hamstring strength. All of these kind of help to make sure that you can stay good and strong for your sport.
Good, great, thank you. That's excellent information. I know there are other injuries that you've seen with females. What are some other common injuries that you see with females that they should be cautious of outside of the ACL?
Right. So it seems like in our office and in a lot of sports medicine practices, females tend to have more ankle sprains, more stress fractures, more concussions, and also something called patellofemoral syndrome or runner's knee.
Okay. Well, thank you so much, Tiffany, for joining us today. That's a short segment on female athletes. We love seeing female athletes in the clinic, and we see them on a daily basis. So thank you, Tiffany, and thank you for watching.